Most of the women coming for gynecological problems tell us that they have issue in their periods or have heavy periods, have clots. At some point of time all through the menstrual cycle in the reproductive age group between 15 and 45 years, most of the women at least 2 to 3 times do have trouble. When they do visit the doctor, we try to find solutions for the problem based on their body nature and what is the problem. But we find that many women have forgotten what they have learnt about reproductive physiology as early as in their 8th class, and so it is difficult at explaining the problem when the basic nature of the normal physiology is not known. So this video we are making so that it reminds you of what you learnt in your school age. I'm Dr. Padmaja Clinic, Vijayawada, and I have 25 years of experience in this field of reproductive medicine. In the human body, every organ system is designed to do one work, and the reproductive system is designed to make babies. As you all know, a baby is formed only when a female partner and a male partner are together. The component from the female partner is an oocyte and the component from the male partner is a sperm. Meeting of these two can lead to the formation of a baby. For women, there is a ovary, there is a fimbrial end of the tube, there is a tube, there is a uterus lining, and there is a pathway out, and there is a vagina. These organs are the reproductive organs of the female. In the ovary, there are large number of follicles. All these follicles are formed when the female child is a 5-month-old baby inside her mother's tummy. But they are all in the resting stage, and only when the girl attains a particular height, weight, mental maturity and changes from a child into a woman does this system start working. And this usually happens at around after 3 to 4 years after starting of the periods, so around 18 years of age. Every month after the menstrual cycle, from the ovaries, around 10 to 14 follicles from both sides together start growing. But the human body is designed to have one baby at a time, because human beings can nurture one baby at a time optimally. So there is a natural selection process, and of the small follicles that are growing, only one of them becomes dominant and is encouraged to grow, and all others step down. This is called the dominant follicle. After this follicle grows, by around 10 days to 14 days, one of this follicle will rupture and release an oocyte. This oocyte is picked up by the tube, and at that point of time, in that 24 hours, when the oocyte is in the tube, if there is a male partner and if they are together at that particular time, millions of sperms are deposited in the vagina, and from them body filters and lets only the perfectly normal forward motile sperms come into the body, and one of them, if it fuses with the oocyte which has been programmed to turn into a baby, there will be a baby. And once there is a pregnancy, in 4 days a developing embryo comes into the uterine cavity, and the endometrial lining which had gone off in the previous menstrual cycle and which grew freshly with the growing follicle and which turned into a soft and spongy layer after ovulation is ready to receive this baby, and if there is a successful interaction between these two, there is a pregnancy. And we know there is a pregnancy after 14 days of ovulation if the periods gets delayed and there is a positive urine pregnancy test. 9 months of careful growth inside the mother leads to a successful delivery. So, for a healthy baby to occur and a healthy pregnancy to continue, what we need are excellent quality oocytes and beautifully swimming, purposeful, normal sperms. Unless these two are healthy, we are not going to have a healthy pregnancy. And this does not occur in every month. It is only every month 10% of people who do try to become pregnant, and the rest of them, the body gets ready to do the same thing and attempt a pregnancy in the next menstrual cycle. I hope you have found this video useful. If you have any questions, do write to us in the comment box. We will get back to you. Stay healthy, stay safe. This is Dr. Padmaja.